Hello, everyone. When it comes to autism, by default, we know that once the child is diagnosed, or rather, when we suspect that a child might have autism, an important part comes of diagnosing the child via assessments. Now, when you approach a professional, there are going to be a lot of assessments that are done. The assessments are of different domains. Remember that autism is a neurodevelopmental issue which affects two major domains. One is the social communication and interaction, and other is the repeated behavioral things that you see. So you will have to do assessments of his social milestones, how well they have developed, language milestones, because language is a part of social communication. Then, when it comes to repetitive behaviors, these are all self-organizing behaviors, some sensitivity issues which put them into those repetitive behaviors. So that is why assessing the motor functioning of the child, that also becomes an important part of diagnosing autism. Okay, so when we talk of different assessments in different domains, you will have different professionals who will assess your child on all these domains. So for example, language development will be assessed by your speech language pathologist, or basically speech therapist. Your motor development, which involves fine motor development, gross motor development of the child, sensory development of the child, that will be assessed usually by an occupational therapist. If we know that the child is also having little problem when it comes to academic functioning, you might need an IQ to be done, the intelligence quotient, what we call it as, that might be done by a clinical psychologist. Many times developmental pediatrician will do some kinds of assessments, say MCHAT, which is a screening tool, CARS, ESA, these are all fancy names that you might come across, developmental quotient, okay? So remember, assessment is a long process, okay? And in these assessments, it is not going to be just the parent who will get some questions asked, but even the child who is getting assessed will have to perform some tasks, okay, which the concerned professional will give. For example, if the IQ is being tested, there could be some task where the child might have to count or read or identify shapes or tell a story out of a picture, okay? Now, if the child is also getting involved, remember, that is where the tricky part lies. By default, we know that many times when children go to a new environment, go to a new person, or they want to meet a new person, most of the children are not very comfortable, right? It's not like within few minutes the child will start fatafat talking or fatafat responding. And here too, we are looking at a child who is having some issues already. So if a person wants to make a child to do some task so that he gets an idea of his development, it is going to be difficult to be done in that session itself. Rather, in my experience, or most of the professionals who are listening to this might agree, that it is not that in one go or one visit where everything gets completed, all the tests are done, all the assessment and questions are completed, and you get correct answers, because child's mood, child's state of mind, how much time you have already spent before in the other professional's cabin, all this will determine that whether you will be able to complete assessments or no, whether the child will cooperate or no. And this is important because, as we all know, that autism can be diagnosed only via these set of questionnaires and task completions, okay? And if the child is in no mood to do it, or he just does it for the sake of doing, or he gets very cranky, then obviously as a professional, I won't be able to get a clear understanding of whether the child is actually lacking in a particular skill, or it is just because he's not doing it due to the other emotional issues, or the lack of familiarity, or the boredom, or the hunger that might come in the way. Okay, so remember that all these assessments cannot be usually done in a one go. We have to be patient as a parent. Many times the rescheduling of appointments can happen, and we have to be cooperative throughout that process, because that will only ensure that we get correct idea of the problem. We don't want the problem to get unnecessarily overdiagnosed or unnecessarily underdiagnosed, because problem definition is the key to formulation of correct intervention which will help the child. So that is one part of the assessment, or rather the understanding of assessment. The second important part that I want to highlight here, and this is specifically also for any professionals who are watching here, is that there are some things that get unaddressed after the assessments from our side as professionals, okay? And those things are something that we have to be mindful and cautious of. What are those things? Well, if you see the nature of assessments, they are the questions which are asked to the parents कि आपका बच्चा ये करता है या नहीं, आपका बच्चा बैठता है या नहीं, आपका बच्चा अगर बात करता है तो कितने हद तक बात करता है. Okay, so what we are doing is we are actually identifying various capabilities of the child, the abilities of the child, has whether he has achieved it in an age appropriate manner or no. When we do this, remember, if answers of the parents for most of the question is कि नहीं ये नहीं कर पाता है, the parent has already gone in a state of, a state of negativity, where they're already feeling bad. They're already, the reality is coming right on their face ki, okay, my child is having this problem too. My child is not able to do this as well. This is coming there right in front of the parent. And this puts them into a very difficult emotional state when the assessment itself is going on. And as a professional, once we are done with the assessment, and we are going to tell them that, okay, your child is not able to do this, and that is why we think of autism, we also need to very explicitly tell to the parents what your child is able to do, or possibly what are the positives of the child, what are the strengths of the child. That also we are able to find out through the assessments, right? It is not that we are able to only find out deficits. We can also identify what the child is doing, which is good for his age right now, or which is probably much more than any normal child for his age can do. And identifying that part and not keeping it with just ourselves as professionals, but also telling it to parent explicitly, will put them in a better state where they will have a hope, where they will not feel defeated, where they will not feel helpless कि मेरे बच्चे को कुछ नहीं आता है, मेरा बच्चे का कुछ नहीं हो सकता है. This is a very common state that parents land up in, and it is something that we have to take up the onus of highlighting the things which the child is also doing. Every day we talk of, strength-based therapeutic interventions for children. We do that, but do we communicate it with parents? Okay, we have to see that we communicate it with parents. And for all parents out there, I would want to say that even though you might experience these set of emotions where you realize that your child is not able to do a lot of things, remember, your child also might be able to do many things which the other children are doing, or better than other children are doing. Okay, so you also can ask, Ki, what do you think that my child is able to do? I got it that he's not able to do so many things, but what is it that you think my child is able to do? Or what is it that you think are going to be strengths of my child? Let's not forget that the strengths of these children are something that also we can capitalize further and help them grow as independent, self-sufficient adults. So every time when a child is assessed, let us also focus on the strengths. Let us get to know of the strengths of the child. Another last thing over here is that, remember, once you get an assessment done and your child is diagnosed, it is not like it is done and dusted. Checking the improvement of the child after you start therapies will need the child to get reassessed. Okay, so for example, if your child has undergone occupational therapy ka assessment and speech therapy ka assessment and a developmental quotient, based on the results, once you know that there is autism, based on the results, the interventions are started, the therapies are started. 6 months down the line, after you give the therapies, your child is going to improve on some of these zones. you need to again subject the child to the assessment, same 3 assessments, and check out, compare the assessments done on 6 months prior and today, and check out that what are the areas where the child has already improved. So suppose child has improved significantly on speech area, then you will be able to identify that and then accordingly further modify the intervention plan where speech therapy sessions can go down a bit, and the areas which are yet to improve, you can further add on the therapies pertaining to that area. So assessment is not a one-time thing. It is a continuous process. Please remember that. That is essential, because if you do assessments and then 2 साल और कुछ नहीं किया, बस therapy चल रहे, that is again defeating the purpose. Okay, you won't be able to find out if the child is improving. You won't be able to find out where is he still lacking. You won't be able to then help the child in that area with a target specific intervention, which is very crucial in autism. So then there is no point of giving therapies, right? So remember, this is again to all parents as well as professionals, that we have to work collaboratively to give assessments to the child in a periodic manner to help us revisit and develop our treatment plans in a better way. And last but not the least, remember the financial aspects of this entire process of assessment. Okay, do not give unnecessary assessments, or as a parent also, let's not subject our child to unnecessary assessments too. Let's not even overdo things. Okay, finances are very much involved. Every assessment can be quite expensive, so orienting the parents about the entire financial aspect and the importance of it is also essential, that we all professionals do, and parents also see to it that they don't even underdo when it comes to assessments and overdo out of anxieties or concerns. ऐसा नहीं होना चाहिए कि 1 महीने पहले स्पीच थेरेपी का असेसमेंट, स्पीच का असेसमेंट किया था, 1 महीना हो गया स्पीच थेरेपी को और चलो अभी देखते हैं कितना इंप्रूवमेंट है. No, that is not going to help. So again, it has to be a collaborative decision. You will have to discuss it with your professional, figure it out the right time of doing right things, and then help the child. Okay, so please remember, assessments are important, and we all need to be very clear of why we are doing it. And let's also start addressing these subtle things while we are assessing these children, of taking care of psychosocial well-being of the parents too.